This brief lecture is about the full body and the integrated skin exam. We want to encourage you to perform a full body skin exam in the context of the overall physical examination. Some patients are at a higher risk for melanoma, especially men over age 50, and they might not request this examination. So the general physical exam is an important opportunity to look for melanomas and other skin cancers, especially in areas patients find it hard to see, like the back and the posterior legs. Be sure to inspect and palpate all skin lesions, focusing on key features that help distinguish if lesions are benign or suspicious for malignancy. There's also a great opportunity during routine examinations that you can pursue an integrated or an opportunistic skin exam as you examine sun-exposed areas that are already accessible. For example, while you're examining the head and the neck, while you're looking at the arms and hands, while you're listening to lungs, you could ask to see the chest and inspect the back. Ask the patient to change into a gown with the opening in the back and the clothes removed except for the underwear. This is the first requirement for the skin examination. Ask if the patient would like to have a chaperone present, especially when the examination is of the genitalia area. There are two techniques of examination for a full or total skin exam. One is supine, or one is seated. For this lecture, I will illustrate the seated exam. Either position allows you to comprehensively examine the skin, but please plan to examine the skin in the same order every time so that you're less likely to skip an important part of the examination. With the patient seated on the examining table, stand in front of the patient and adjust the table to a comfortable height. Start by examining the hair and the scalp. Separate the hair to examine the scalp from one side to the other. You may need to use your fingers or a cotton-tipped applicator to separate the hair to see the scalp. Note the distribution, texture, and quantity of hair. Remember to inspect the ears. Now inspect the head and neck, including the forehead. Eyes, including eyelids, conjunctiva, sclera, eyelashes, and eyebrows. Nose, cheek, lips, oral cavity, and chin, and then inspect the anterior neck. Move the gown to see each area. Ask permission first by saying, "I'd like to separate the gown to look at your back now. Is that okay?" Do this for every part of the body. Now inspect the shoulders, arms, and hands. Inspect and palpate the fingernails. Note their color, shape, and any lesions. Keep in mind that longitudinal bands of pigment are normal in people with darker skin. Now inspect the chest and the abdomen, preparing the patient by saying, "Let's look at your upper chest and then your stomach area." The patient will generally help by lowering or raising the gown to expose these areas and covering up when you're finished. Now let the patient know that you'll be inspecting the thighs and lower legs. You and the patient can work together to expose the skin in these areas, moving down to the feet and toes. Inspect and palpate the toenails and inspect the soles and between the toes. Now ask the patient to stand so you can inspect the lower back and the posterior legs. If needed, ask the patient to uncover the buttocks. Remember, examination of the breast and genitalia may be saved for last. Techniques of examination when the patient is supine and then prone. Some clinicians prefer this positioning for a more thorough examination, although the patient may feel like it's more, quote, clinical, unquote. Practice and feedback from patients will give you a sense of the patient's preferences. Start with the patient supine, lying flat on the exam table. As with the seated position, start by inspecting the scalp, face, and anterior neck. Next, move to the shoulders, arms, and hands, then to the chest and the abdomen, anterior thighs and lower legs, and feet. and if appropriate, the genitalia. As noted previously, ask permission when moving the gown to expose different areas, and let the patient know which areas you'll be examining next, so the patient feels more involved in the exam. Now ask the patient to turn over to the prone position. Lying face down, look at the posterior scalp, posterior neck, back, posterior thighs, legs, soles of feet, and buttocks if appropriate. Thank you.